be the same argument that they were defending in the circuit. But what looked a little bit, strange that there's a case and you don't go there at least with an amicus curiae or something like that. You have to participate. So I imagine they would have to take a position. Maybe they are waiting to see what the circuit do. But at the end, they have to be part of the case. Or announce, I'm not appealing, I'm fine.
Yeah, I mean, if there was an appeal, I'm sure they wouldn't want to keep that one. They would think they would lose the case. They would want to preserve their own argument.
They were pretty much in alliance in the circuit.
¿Se conectó? Yo creo que ya está conectado. I think that's demasiado rápido. Creemos que está conectado. Ya, bueno, otra vez, eso fue lo que yo hice.
Okay, let's go then.
Y se ve aquí.
Le voy a poner esto. I don't think we should start it yet until like
Ellos ya lo empezaron.
open. Should I start it then?
Sí.
Okay. Por eso, así que vayan a entrar entonces aquí.
Ya le puse el copy.
Ya empezar.
Okay, good afternoon, everyone. I want to thank you all for being here. This is a press conference to talk about what we hope is a bipartisan territories initiative to support us in terms of health care. The 5 U.S. territories, the Virgin Islands, Puerto Rico, Guam, American Samoa, and Northern Mariana Islands, are part of the American family. The nearly 4 million people who live on these islands are Americans and subject to federal law like everyone else. Hundreds of thousands of Americans from the territories have served our country in the armed forces. Many have died in service to this country. Some challenges we face are exacerbated by federal policies, which are within the power of Congress to change. Healthcare funding is a leading example of the substantial burden the federal government has placed on local governments in the territories. For example, for specifically Medicaid. Medicaid is the main insurance payer to our hospitals, but the disparities in payment from the federal government to the states versus the territories under the program are significant, and this has been an issue for decades. It has become an even more serious issue in the aftermath of the natural disasters that the territories have all experienced in the past 2 years. Federal Medicaid funding in the states and DC are open-ended, while the Medicaid programs in the territories are subject to annual federal funding caps, allotments. Once the cap is reached, the territory must assume the full cost of Medicaid services. The annual federal capped funding has been supplemented by additional Affordable Care Act allotments since July 1st, 2011. This crucial support expires on September 30th, 2019, known among us all as the fiscal cliff. The rate of federal matching funds, or FMAP, for that supplemental allotment was increased from the normal limit of 55 to 100% for the Virgin Islands and Puerto Rico in the aftermaths of Hurricanes Irma and Maria. Otherwise, the arbitrary low rate of federal matching funds has forced the governments of the Virgin Islands to spend more local Medicaid dollars than a state. The states, us having to pay 45%, when in places like Mississippi, which have the same demographics as us, the federal government pays 81%. That is not fair, it is not within parity, and it is not equitable. This is a fundamental underlying problem that the territories have, a limited FMAP in addition to a cap on overall funding. Before the 2017 hurricane season, a state-like FMAP alone, if we had been treated in the same manner as the states, it would have provided the government hospitals in the Virgin Islands approximately $22 million per year in local matching funds and would have reduced uncompensated care costs and subsidized the local treasury. We saw the effects of this in the hurricanes, where our hospitals were destroyed because hospital administrators have to make the decision between putting a new roof on, supplementing, paying doctors and nurses and healthcare individuals. In addition, even before the storms, the territory's 2 hospitals, publicly owned, were excluded in the Virgin Islands from the Medicaid disproportional share for hospitals, the DISH program, in spite of the significant amount of uncompensated care provided. After the storms, with increased demand combined with the collapse of revenue, the Virgin Islands was not able to produce the required 45% of each federal Medicaid dollar. Even the supplemental allotment provided with 100% federal funding will not be enough to get us through our recovery, and an extension of the matching fund waiver will be necessary, along with access to additional Medicaid funding beyond the fiscal cliff. I've been working since I started Congress to address the fundamental problem, which is that the territories are forced to operate Medicaid under statutory caps. The caps are antithetical to the purpose of the program, to be able to expand and contract based on local need. I have sponsored legislation, joined with my colleagues from the territories and other colleagues here in Congress, to correct the inequities we face under Medicaid, in part by lifting the Medicaid caps and by providing for fair inclusion of the territories in Medicaid. I have recently reintroduced this legislation this session, H.R. 1354, the Territories Health Equity Act of 2019. The territories also face inequities regarding Medicare. For example, the hospitals in the Virgin Islands are compensated under Part A through a system using out-of-date reimbursement formulas. Payments to the 2 hospitals are based on 1982 and 1996 costs, respectively, annually adjusted for inflation up to the rate of increase ceiling. Due to the large permanent changes in Medicaid services provided, the cost of care at both hospitals is not comparable to the inflation-adjusted expenses of their base year. The territory's health equity legislation would also address the low hospital payments under Part A. It also would provide the small territories access to Medicaid DISH and improve the treatment of the territories under Medicare Part D low-income subsidy programs. We must confront the difficult reality that these territories and our U.S. citizen residents have been neglected and allowed to fall behind. This bill attempts to bring parity and equity to the territories, American citizens living abroad. Thank you. And at this time, I would invite my dear colleague, my sister from Puerto Rico, Representative Jennifer Gonzalez Colon to address you all.
Thank you, Stacy. And as Stacy just said, we are like sisters here. I mean, even when we are Democrat or Republican, and that's constituted a bipartisan bill, I think this bill is so important for the territories just to address inequity that has been there for many, many years, as she just said. I want to say thank you to her for her leadership. During the last Congress, we worked together in some measures like this ones, and now she's taking the lead in this effort, and we are jointly working with her.
Yes.
Like my friend Amata Radewagon for American Samoa, Mr. Michael San Nicolas from Guam, as well as Representative Jose Serrano and Nidia Velasquez, that are co-sponsoring this bill. This bill looks to improve the treatment of the U.S. To the 5 territories. And under the Medicare and Medicaid programs, both of them, as she just said, are capped in terms of the federal available funding, the cost share, the FMAP, as we call it, to the territories to a 55% cap. You never have that cap in the rest of the states. Either in the case of D.C., they got a 70% matching FMAP. So that means that in case of Puerto Rico, we got 55%. That means that the territory needs to put the other 45% in order to have access to this system, to this program. But all territories need to comply with all federal laws and services to the population they're serving. So this is one of the main issues. Puerto Rico got 45% of people living under the poverty level line. When you compare that to the rest of the states, even to Mississippi, it will be just 21% of under the poverty level. In the case of Puerto Rico, approximately half of the island residents are living on that poverty level line, and that's the reason Medicaid funding for the states and D.C. are unrestricted, and the federal share is related directly to the per capita income. This is not the case of the territories. These limitations in terms of the funding prove the inefficient proper care for half of my constituents. And that's the reason that if we are not addressing this in this kind of bill, we're going to have in the 2020 budget, a lot of federal funding will revert statutorily to the cap of 55%. Why? Because we managed to include during the Disaster Relief Budget Act a federal cost share of 100% for Puerto Rico for 2 years in a row. That never happened before. So there was a direct allocation just to the case of Puerto Rico of $3.8 billion. And that is going to be ending in September of this year. So that's the reason we need to fix in the long-term solution the situation with FMAPs and to have at least the beer to close to 80% of the cost of Medicare program. Correcting this disparity with this bill will prevent future Medicaid cliff, as we always are facing every 2 years, all the territories as well. And there's one section of the bill, section 102, that eliminates that 55% of cap with getting us the opportunity to raise up to 83% as the rest of the states. I think it's important just to put in the record that in the case of the DC, the FMAP is set by statute by 70%. So this is important, and I want to recognize Representative Darren Soto to be here with us today. He's always supporting all of these bills as well. In the case of increased payments to the care hospitals, as just Stacy was saying a few minutes ago, in the case of Puerto Rico, under IPPS, increasing those reimbursements will help out to pay our providers. We are losing more than 100 doctors per year. So we're talking about a doctor per day losing during the last three years in a row. That means our providers are moving to Texas and to Florida. So we are in a direct need of raising the cost and the reimbursements to our providers as well. This bill will also provide a transition period for automatic enrollment under Medicare Part B for Puerto Rico. In our case, we are not in an opt-out position, it's just opt-in, and that is creating that more than 30,000 people in the island are paying penalties by year up to $20 million. That money can be used for drugs and other prescriptions as well as treatment. One of the other areas, and we're talking about every person of 65 years old that are not enrolling in Medicare Part B, Right now, the rest of the states is automatic. So that provision in the bill will help us to be as the rest of the states, and that's just in the case of Puerto Rico. Additionally, the bill will increase the payments to Medicare Advantage plans in the territories and increase the amount of federal funding for territories to provide prescription drug coverage to low-income Medicare beneficiaries through Medicaid Part D. And this is a very important area for our elderly people back in the island. Currently, Medicare medical advantage plans in Puerto Rico are paid less than any other jurisdiction in the United States, including the Virgin Islands. 25% less than even the Virgin Islands. And if we look at the average to the rest of the nation, we're talking less than $511, when the average in the nation is $842 per patient per month. This is creating a low stability in terms of the services that are being carried in Puerto Rico, as well as the providers. The other issue is that we are trying to work with the exodus of patients and providers on the island, and I think this bill will help us to address that issue. 77% of our Medicare beneficiaries receive their care through local Medicare Advantage, and that's the highest number in the nation, and that's the reason this provision is so important to address. And when you compare that, payments are only 57% of the U.S. mainland average. So I think this bill not just will help the territories, it will create at the same level of sustainability for the Medicaid that you receive in the nation, but you're capped in the territories. So we are talking about finishing and eliminating those inequities for American citizens living in the territories as well. Puerto Rico got 3.2 million American citizens living in the island, of 3.8 that were 5 years ago, 10 years ago. So this is a direct measure. I think this is one of the most important bills that have been filed, and I hope we can work in a bipartisan way like we're doing this today, because all the territories are affected by this.
Thank you so much. And we are, as Jennifer said, joined right now by Congressman Darren Soto, who represents a district in Florida, but has been a champion and a huge supporter of the territories, particularly Puerto Rico and the Virgin Islands. After the hurricanes Irma and Maria, we all looked, and Darren was one of the first who stepped forward to offer support. Those in his district of Orlando and other places really opened their arms up to not just give us a helping hand, but to support us and continuing to support us in the recovery and rebuilding of the territories. Darren?
Thank you so much. I'm honored to be joined by my colleagues, Congresswoman Plaskett and Congresswoman Gonzalez-Colon. We know healthcare is the biggest issue of this Congress, and so we cannot overlook healthcare equality in our nation's territories as well. I come from Florida, where we have a strong connection, both culturally, economically, with both Puerto Rico and the Virgin Islands. And so I'm proud to be able to stand here to help support the Territories Health Equity Act 2019. We have a very basic set of plans here in the House. One is releasing initial plans to help out our territories, whether it's this act or the Puerto Rican Recovery Blueprint and other bills that I'm also working on with Congresswoman Plaskett. But then the Natural Resources Committee is going to go down to Puerto Rico to hear about inequities there, and then we're going to go back up and be here in Washington to have oversight hearings on issues affecting the Virgin Islands, Puerto Rico, and other territories. But I also serve on the Energy and Commerce Committee, and I've also been have spoken with Chairman Pallone and others about by having this unique position of sitting on both these committees to address this very issue of Medicaid equality for the territories and healthcare equality. We take no enjoyment in knowing that there's been an exodus of doctors from Puerto Rico to Florida. We want Puerto Rico, we want the Virgin Islands to succeed, and that means we have to have a well-funded system that has top-notch hospitals, that has access to health care, that creates a system where doctors want to continue to practice in the Virgin Islands, that want to continue to practice in Puerto Rico. And so I'm looking forward to working with my colleagues and helping out with this critical initiative for healthcare equality for all our territories and for all Americans. And thank you, everybody, for having me.
Thank you. This time we'll take the questions. Matt, CBS.
Sure, appreciate it. I guess mainly a question for the members of the territories first. If you could quantify how many people are leaving the territories to go to the United States or elsewhere for treatments. And secondly, we'll kind of spin off of that, and if you could talk about the recovery efforts for things like hospitals, doctors' offices, where that stands as well.
Sure. You know, a lot of the information right now is anecdotal in terms of individuals. I know that my colleague Jennifer has talked about those doctors that are leaving, but we're well aware, even before the storms, of individuals who leave, whether it's one-offs to go to hospitals for other hospitals for treatment and for medical services, for families that have to move because they have individuals with chronic care issues that are not going to receive the treatment. They fall within that gap. They're not so low in terms of their income that they're going to be able to stay on Medicaid, but they fall within, because the Virgin Islands, in our case, because we have to have the 45 matched, and that has always been the case, we have had to keep the rolls down of those individuals who really do qualify for Medicaid in any other jurisdiction. But because we're going to be at a cap, and because we have that match requirement, we make a cutoff that is an unrealistic and not truthful to the needs of the populace. And so if people are able to live elsewhere, to move elsewhere, they go elsewhere to take care of that. Additionally, when we saw in the storms, in the case of the Virgin Islands, both of our hospitals had tremendous damage. One more than 50%, it has to be rebuilt. The other, it's questionable even if it's 50%. We have made the argument, and Congress was very truthful about that when they changed the Stafford Act, that the rebuilding money needs to be billed as it should be, not billed as it was. But part of the issue in terms of our infrastructure was because of the lack of federal funding, or the equitable funding by the federal government, whether it came to highways and particularly when it came to Medicaid. So for many years, we were not doing the deferred maintenance and the other things that needed to be done, because healthcare dollars were going to make payments in areas where they weren't having to do before. And particularly with our hospitals, if this is not addressed, the hospitals will have even a greater burden because of the number of uncompensated care, individuals that are going to be going to the hospital as primary care places rather than going for emergencies or for surgeries in the manner in which they are. That's, I think, going to be a major focus and a major problem if this fiscal cliff is not addressed. I don't know, Jennifer, if you have any additional information.
In 2017, there were, in the case of Puerto Rico, over 1.5 million people covered by Medicare. Now it's 1.2 million people. That includes all the people who are dual eligible for Medicare and Medicaid as well. Same thing happened with 84,000 people on their SHIP program. And at that time, I mean, as Stacy just said, there's no specific data that can show us how many people are coming back to the island. We do know that after the hurricane, more than 200,000 people left, but some of them already are back at home. That number, we are not going to be sure when that number is going to be hitting the final end of it, but we do know that a lot of people are moving actually for Florida. And that's the reason I want to thank Darren Soto. He's been always a champion of Puerto Rico, not just now, during the last Congress as well. And that's the reason, I mean, I think he is a sponsor of all my pills because he's been working across the aisle, not just now, since the beginning. And I want to say thank you to you for all your leadership in that endeavor. But as Stacy just said, our people are leaving because they can't access the same quality. And why? Because we're not paying enough to the providers. We're not paying enough to the physicians and the rest of the providers as well. And you're asking the territories to pay less to their providers to have a quality care. So when you compare the average payments for the rest of the nation and the payments for Puerto Rico and the U.S. Virgin Islands, American Samoa as well, you will see that there's a big gap over there, and that's triggering. That's actually forcing all providers, including physicians, to move from our islands. the two hospitals, Stacy just talked about it. We're facing the same thing in Puerto Rico with the private sector. So this should be something that we address immediately because it will cost a lot of problems down the road. We filed even a bill, the PRIMA Act, just to stabilize the healthcare industry in Puerto Rico for at least 2 years. But if we don't address this bill, which is a long-term bill for the territories, we are going to be doomed in terms of getting our people getting the healthcare they need.
You know, I think I want to reemphasize what was just said about this is really the fiscal responsible thing to do. That it will cost the federal government in the long term more by not fixing this than by fixing it on the front end and making it equitable, which is why you're seeing so many, members of Congress supporting this who are both Democrat as well as Republicans.
And actually, just adding to what Stacy just said, during the last year, we managed to have an island, more than 100 members of Congress visiting, same as U.S. Virgin Islands. And we got the people from Energy and Commerce Committee down there, and they saw with their own eyes, boots on the ground, the problems we're hitting in our hospitals, the low-income subsidy that is not applying to the islands, the DISH, disproportionate share hospital that Stacy was talking about that do not apply. Even when we do pay the hit, the health care insurance tax, territories are not getting anything from that. So that's the importance of getting some of the provisions included in this bill.
Okay. Are there any other questions?
Yes, I would like to know, the bill provides parity to the territories or not, and how much will cost, and which committee will have jurisdiction? Energy and Commerce and Ways and Means, or?
Energy and Commerce is the committee that handles all the issues of healthcare. I assume that is going to be in Ways and Means as well, in second jurisdiction. In terms of parity, we are asking for the same benchmark the rest of the states are having. Even the DC jurisdiction, they got it fixed to 70%. So if both territories can be measured by the same benchmark of the rest of the states, in the case of Puerto Rico, it will be up to 83% of we can access of Medicare. In the case of Virgin Islands, and I assume the numbers are going to be 81. So that means we are not asking for anything the rest of the states got. So it's accessing the same opportunities and the same healthcare cost share that the rest of the states are having, using the under poverty level line that is being used under per capita for the rest of the states.
As well as the cap.
Exactly.
So no other jurisdiction, except for the territories, have a cap, a ceiling at which the federal government will not give money, even if individuals qualify.
And how much money will be for Puerto Rico and?
So we know for the Virgin Islands, the addition of this, if we were not to have it, for our hospitals alone, it would be $22 million per year that we would be able to receive. Which in a small place like the Virgin Islands, it's because of the amount of poverty that is within the territories, that would be a tremendous support to the hospitals, which annually are under budget or annually are operating at a deficit.
In the case of Puerto Rico, we are capped to $357 million a year. With this measure, it could be up to $2 billion.
So I know there's another question, and this is coming from the Virgin Islands source. What are the bill's prospects for passage? Is there any Republican, any Democratic allies of support? So as we said earlier, we do have Republicans as well as Democrats who are supportive of this. As Darren Soto says, he is a member of the Committee of Primary Jurisdiction, that being Energy and Commerce. And we've had conversations with the chairman, Frank Pallone of New Jersey, as well as talking with Diana DeGette, who's the chairwoman of the subcommittee of jurisdiction of this. There are numerous allies, particularly those members of Congress who not only feel strongly that there should be equity across the board for all Americans, but those members of Congress of New York, Florida, Texas, who have large numbers of constituencies who are from the territories as well.
And just adding to that, because I totally support what she just said, we got opportunity to have roundtables in Puerto Rico after the hurricane with the Energy and Commerce members. At that time, Chairman Greg Walden and Ranking Member Malone, and the chair of the subcommittee at that time was Dr. Burgess. So all of them know this issue directly, and they're willing, and we've been having conversation with, in this case, with the ranking members, Walden, Burgess, as well as others, in terms of they know we need to fix this in a long-term solution, and this is the bill to make that happen. So now it's going to be for us to push for that in that committee. I got conversations with Diane DeGette as well, and she totally, support getting this problem fixed. As the now chairman of the committee that is committed to that as well. So I think this is a great opportunity for us to work together in a bipartisan way to get things done.
Español.
En español, claro. You're learning. Quiero agradecerle a mi hermana de las Islas Vírgenes, Stacy Plaskett, quien ha radicado en esta mañana junto con nosotros este proyecto 1354 que busca eliminar el cap que se le tiene a los territorios. En este caso, los auspiciadores de este proyecto son Amatarra de Wagen de American Samoa, Michael San Nicolás de Guam, al igual que los congresistas José Serrano y Nidia Velázquez. ¿Por qué este proyecto es importante? Los territorios actualmente tienen un cap de un 55% al momento de recibir fondos federales para manejar su Medicare. El resto de los estados no tiene un cap. Así que esto va a permitir que ese 55% de pareo federal, que Puerto Rico tiene que poner 45%, al igual que las Islas Vírgenes, al eliminarse nos permitirían accesar la misma cantidad de fondos que reciben el resto de los estados para su sistema de salud. Por ejemplo, esto se basa en el nivel de pobreza. En el caso de Puerto Rico, 45% bajo los niveles de pobreza, lo que significaría que nuestro ingreso per cápita nos permitiría accesar hasta un 83% del FMAP o el Federal Cost Share que se utilizan en los estados. En el caso de las Islas Vírgenes, casi un 81%. Esto le quita la situación de inestabilidad a los territorios, a su sistema de salud, cuando tenemos que estar cada 2 años pidiendo asignaciones adicionales para asuntos de salud. De hecho, el proyecto también incluye provisiones para que nos aplique la parte de Medicare, la parte de medicamentos, que nos incluye también en el caso de Puerto Rico. Más del 77% de nuestros participantes están en los programas de Medicare Advantage. Sin embargo, no reciben la misma cantidad de pagos por mes por persona que se reciben en el resto de los territorios y en el resto de la nación. De hecho, Puerto Rico está 25% por debajo de las Islas Vírgenes y casi 42% por debajo del resto de la nación. Esta medida busca igualdad, igualdad y acceso a los recursos de salud que evitarían las fugas de profesionales de la industria de salud de la isla, que hoy se están mudando a Texas y al estado de la Florida, y nos permitiría atender el exacerbado problema de salud que tenemos con nuestras personas de 65 años o más. El proyecto también incluye una provisión para que nos aplique de manera automática la parte B de Medicaid, que hoy hace que más de 30,000 participantes del programa de Puerto Rico paguen $20 millones en multas de por vida por haberse inscrito tarde en este programa. Así que este proyecto nos permite en arroyo habichuela, como diríamos ahora, operar la parte A, la parte B, todo lo que tiene que ver con la desproporción de los costos en hospitales. Así que para el caso de los hospitales vamos a poder recibir las ayudas. En el caso de las Islas Vírgenes y Puerto Rico, todos los hospitales han sido afectados luego del huracán y previo al huracán. Y la parte obviamente para la parte de medicamentos. Así que esta medida cuenta con un respaldo bipartita, Stacy dirigiendo la parte demócrata, yo dirigiendo la parte republicana, y el Comité de Energía y Comercio, que tiene jurisdicción directa sobre este comité, y su chairwoman, en este caso del subcomité, Diane DeGette, son los que tienen la jurisdicción sobre esta medida. Yo espero que podamos moverla. La estamos radicando temprano en este año para precisamente terminar con lo que ha sido el sistema de trato desigual a todos los territorios. En el caso de Puerto Rico, 3.2 millones de ciudadanos americanos. Now you were saying in Virgin Islands?
No. Same thing, same English. But and the only other question that we received, and I want to thank everyone for being here, is this really will be an expansion of individuals who are able to receive health care in the territories by removing the cap. Those we've suppressed the amount of people in the territories who were able to qualify. We put the qualifications down lower because we knew that we had a cap on it and could not, based on, Medicaid is supposed to expand and contract based on the population. We haven't been able to do that. This does not address the disparity within the Affordable Care Act, which kept Virgin Islanders, Puerto Ricans, other members of the territory out of the mandates that are within the Affordable Care Act, which have left a lot of individuals out of healthcare in the territories, and that will have to be addressed by other legislation.
Just to add one more thing, when you say expanding the opportunities, the reason is Hawaii, for example, and Alaska got, I think, for qualifying for receiving this is up to $11,000, $12,000 a year. In the case of the territories, as we need to maximize the resources we're receiving, we put ourselves a cap of $26,000 or $25,000 to qualify. That means that the benchmark is more higher and less people are qualifying because we don't have the resources to make that happen. At the same time, there's a lot of federal programs that we're not using because we never got the federal, the local funds to match those federal programs as well.
Okay. Well, thank you all so much. Mike?
Thank you, everybody. That's it. Thank you.
This is yours.
No. Someone's phone up here.
Oh.